Thank you, Gal. I'm mostly a clinician nowadays. I used to do much more research several years ago, and it wasn't on autism mainly. It was mostly genetics of other psychiatric disorders. So my interest in this question comes mostly from my clinical work, but it also has very much relevance to research and to public health. I was happy to see that other people have used this number, but this is obsolete because the number is now 1 to 44 by the CDC, which means 2% of the population is diagnosed with autism, at least in the US. And the same goes for Israel. These are numbers, also old numbers that I got from Alut. And they show you see my cursor. So they show this increase that started in 2013. This is DSM-5 year of publication going up, and it shows you not only the number of children that were receiving benefits from the National Social Security, but also in gray here, in a different scale, the number of the children that by Alut should have been diagnosed with autism and were not diagnosed yet. So in Israel, people are still thinking, and this was a debate that I had with Gal when I proposed to give this session, that we don't have overdiagnosis, but even maybe underdiagnosis. But look at this graph, that, again from the CDC, that shows you the numbers from the early 70s to today, to the 1 in 59. And when I studied medicine, it was about 5 in 10,000. I have questions, but maybe keep them for the end. I'm afraid I won't have enough time, but I'll be happy to talk to people after the session. So 5 in 10,000, with the numbers were then when I started to study medicine, it went up to 1 to 59. There is, to the best of my knowledge, there's no, apart from maybe from COVID, which did not exist, nothing like that in medicine, nor, and especially not in psychiatry. There is no phenomenon like that. Something went up in prevalence so dramatically over 30 or 40 years. And this is not only, when you talk about the whole population, but even if you go and do very well-performed research like they did here in a whole county in the UK in 2006 already. The numbers then in 2006, they already introduced the term autism spectrum disorders. We're approaching 1% for the whole spectrum, and even much more than we used to diagnose now than those days for the narrow definition of autism. So, of course, this has an effect, and the effect, which I'm going to discuss at the end again, is that when you have an epidemic, then people start looking for the cause of the epidemic. And the worst effect of that was that people stopped vaccinating their kids. And this is another old study from a county in California, where they tried to fight back the epidemic, and they made the arrows here at the bottom show you different measures they took in order to fight this effect of the vaccinations. They made changes into the vaccination regime, and still the numbers, these are numbers of diagnosed children with autism in different age groups. Up till today, the age group of 2 is still underdiagnosed, but on all other age groups, they were not able to stop this epidemic. So I think I wrote in my proposal that most clinicians, at least, think that the cause of this phenomenon is the broadening of diagnostic criteria. And Gal asked me to change it to many, not to most, but at least when I talk to my colleagues, most of them agree with me that this is the reason. This is another slide from CDC showing the prevalence of intellectual disability in people diagnosed with autism in different states in the US, females and males. And Karen asked about it before when we had a small talk before we put the presentations on the computer. And you can see that nowadays the average is about 30% of people with autism spectrum disorders have a diagnosis of intellectual disability, which is exactly the opposite, or much less than what we used to know when we, Gal and I went to medical school and learned about autism. I remember I had the privilege to do an elective course in the Child Study Center in 1990. When I was a medical student, I heard Fred Volkmar, which you probably all know, read a text that was written by a high-functioning person with autism. And this was like, you know, someone telling you that he met a Martian, and he was reading you the text that this Martian wrote about how it is to be a Martian. When I came back to Israel and I told this to my teachers in the psychiatry department at Hadassah Medical School, they thought that I came from Mars. And so nowadays we're talking about a totally different population of patients than the ones that were treated 30 or 40 years ago. So I'm still not saying that this is overdiagnosis. This is broadening the diagnostic criteria, but we should be careful that we're not broadening them too much. Another related, I don't think that this can explain the whole increase in prevalence of autism diagnosis, is the decrease in the diagnosis of intellectual disability, as you can see from these numbers from the US. So these are data from Gal and his colleagues that help me. I don't know if he agrees that this is the interpretation. You can argue both ways, that we, apart from broadening rightfully or truly and talking about other people who have autism, but milder form of autism, or not the typical and narrowly defined autism that Kanner described. But apart from that, we might have a phenomenon of children and maybe even adults who are giving the diagnosis when it is not justified. And why do I say this? I say that, why do I think that I have support here? Here you can see the rate of diagnosis under the age of 4 of autism spectrum disorder in the Ministry of Social Affairs, 1 to 10,000 in different parts of Israel. And as you can see, in Tel Aviv you have many more cases of diagnosed autism compared to other parts of Israel. Be'er Sheva and the Negev are not the lowest for some reason, as opposed to what you told me. And to support this, you can see that if you compare the rates of people with the diagnosis of autism from the same study, according to socioeconomic cluster, you can see that many more people who are from families in higher socioeconomic cluster are diagnosed with autism. So what does it mean? Maybe these people are more aware, maybe they have more resources to obtain a correct diagnosis. This can also support this interpretation. These are the same graph, but for kids under the age of 5 who are diagnosed in autism. Here you don't see this bias towards the higher socioeconomic classes, but you see people from more moderate socioeconomic classes also being diagnosed with autism. It can mean that when the autism diagnosis is severe enough to manifest or to be clear under the age of 5, then you don't have the bias towards diagnosis in higher socioeconomic classes or people who live in the center of Israel. We all know that the DSM-5 or DSM at all is not the Bible. I have another slide that we didn't put it here of someone swearing on the DSM, but it is not the Bible. It is made by people who sit in committees and have votes on if or not to change a specific diagnosis and the criteria. And they have reasons for doing it. So some of the reasons are that there's accumulating data. For example, that there is not a distinction between the different PDD diagnoses from DSM-4. When I was then at Yale at 1990, I was evident to the very intense debate whether Asperger and high functioning of autism is the same diagnosis or not. And even Donald Cohen was willing at the end to admit that they might be the same. And of course, the criteria became much more strict. Apart from that, and you all know them, I just highlighted the differences, but so one of the differences is that you have in the first domain, you need to have all criteria, and the second one, 2 out of 4, and you cannot diagnose PDD and OS according to very mild and insufficient criteria. And I don't think that any one of you will object me saying that apart from all of these reasons for the changes in DSM-5, there was a worry of the profession that we are going to get too many people diagnosed with autism. It's going to be an inflation with people with PDD and OS, and this was one of the reasons that DSM-5 came out with more stringent diagnostic criteria. There is a whole idea that DSM in general, not only related to ASD, but there is an inflation in diagnosis because of DSM. So in trying to find data that will support my hypothesis of overdiagnosis in autism, I found that there is this study of a meta-analysis of studies comparing the results of changes in DSM additions on the diagnosis of the same individuals in different, not only autism, but different psychiatric diagnosis. And for example, when we moved from DSM-3 to DSM-3R, there was an increase. This was back in the 80s in the diagnostic rate of autism. But the change from DSM-4 to DSM-5 made about 15, this is the average, 15% of people lose their diagnosis. And you all know that because I think most of you were here in 2013 and the whole worry about people losing their diagnosis because of the change from DSM-4 and DSM-5. But it did not affect real life. The numbers still go on, and if you remember, I showed you how the graph even started upsloping in Israel from 2013 and not downsloping. And luckily enough, I met Professor Mimuni Bloch. Is she here? Yes. Hi, Professor. She's a newly appointed professor, so give her a and she actually drew my attention to, I think I participated in this, Aviva, did I participate in this study? I think I did, because it was as a, okay, but you're the senior author, and yeah. So this is a survey, a questionnaire that was distributed to pediatric neurologists and child psychiatrists in Israel, and I participated as, not as a researcher, but as someone who completed the survey about their perspective about the issue of rising autism spectrum disorder incidence in Israel. And one of the questions was, of all ASD diagnoses, what percentage of diagnoses do you think were given despite having some doubt? And the options were between 1 to 10% to above 50%. If you sum up all the responses that thought that more than 10% of diagnoses were given, even though there was uncertainty, it comes up to 53% of clinicians in Israel think that when other people give the diagnosis of ASD, there's a considerable amount of uncertainty. So why do I care? I care because a patient called D and many others come to be hospitalized in Italy because of misdiagnosed autism. This is my interpretation. What is the story of D? D was 8 years old when he was hospitalized in our department, child and adolescent department at Itanim. He's second out of 3. Maybe there's a family history of autism, but there is a lot of marital discord as parents keep on fighting even after they separate, and the kids are in between. He has a history of developmental delay with speech delay, special education already in preschool, and severe behavioral problems. At the age of 7, he was diagnosed with autism spectrum disorders, and he was placed in a special education class in Kitat Tikshoret, which made things much worse. His behavior just deteriorated, and he became suicidal, which was not the case before. No medication helped him, not even cannabis. I don't know if Adi is still here. But
Suicidal at 8 years old?
Yes, we have 5 years old who are suicidal or hospitalized in our department. So he wasn't the youngest. And he was hospitalized for a year, so we knew him very, very well. And did we think that we had autism? The first week that he was in our department, the teacher aide, Sayat, from our special education school in our department asked who gave him the diagnosis of autism. Why? Because he had good eye contact, he had social smile, he was engaged with other kids, but he got into a lot of fights. He had labile mood, that's true. He had anger outbursts, he was anxious, he had rituals, which you could maybe say repetitive behavior. For sure he had ADHD. And when we looked at his diagnosis that put him in the special education class in the Kitat Tikshoret, it was done by very good professionals, based on ADOS and DSM-5. But even without knowing this kid, reading it, we were not convinced that this was the case. We thought that the case was, and this is something that we see a lot when the diagnosis was given because a lot of pressure from the parents. We knew for sure, because we knew other clinicians who treated the same kid before he was diagnosed with autism, that the parents were looking for the diagnosis, that many clinicians refused to give him the diagnosis. And finally, the parents found the people who agreed to give it. So I have another case, but no time. You can believe me that the second case is similar, and we see dozens of these kids. I've been working at Itanim as the director of the department for 12 years now. I think from the time I'm there, and we see more and more of them, I saw dozens of kids who come to us, and we think that the diagnosis of ASD was wrong. And I also see kids like that in my private practice, outpatient practice. What are the problems? So, you can, I'm sure that many people have other views, and
You can show the other side as well.
just a minute, okay? 2 more slides, and then hopefully we'll have time for comments. What are the problems? The epidemic, as I spoke before, causes people to look for unsubstantiated fear of environmental factors, when we know, and I was happy to see, I'm interested in genetics, and this is my main research focus, but we all heard the talk today. Until today, autism is thought to be mostly heritable and genetic, and if there is an environmental effect, it's much milder. Cannot explain an exponential increase in the prevalence. It harms research. If you do your research on children with the wrong diagnosis, you will not get the right answers for your questions. You will be studying maybe the cause for psychopathology in children in general, or something like that. Of course, the state should worry that the funds are not being allocated correctly. Actually, one could argue, and I agree, all kids need support. The fact that in Israel kids with ASD get more support than other kids is unfair. But the way to fight it is not to give them the wrong diagnosis. And I know, I would not say Israelis, but I heard a very esteemed American colleague who came to Israel to give a talk, and he said, I don't care if the the family needs support. And the only way to give this kid support is to give him the diagnosis of ISD. I will give him the diagnosis of ISD. And he said it out front, in front of many people who heard him say it. That's an example of an unethical person. But it also harms kids who are placed in the wrong place and get the wrong treatment. And I would like to get your help mostly. I'm sure that other people think differently than me. Let's get together and study this. And it's very difficult. I'm thinking about it for many years. I couldn't find a way. Maybe someone did this study. I couldn't find a way to do this study because there is a conflict of interest. Many people do not have an interest to prove or disprove my hypothesis. It will be very difficult to get the cooperation of people who work in diagnosis children and think that they do it correctly and don't want anyone to check it. Of course, I have a bias. I might have a biased or a problem of ascertainment bias because I see the kids who don't get along in Kitot Tikshoret get worse and come to me, but it's a big chunk of the population, and I hear the same from my colleagues. I'm not the only person who works in such a department. What would be the control group? And of course there are ethical problems because if you take, and this is something that we see, the parents come to us and say, look, we know that our kid doesn't have autism. We always knew that he doesn't have autism. We were willing to get the diagnosis because we need the help and the benefits. But don't take away the diagnosis because this way we will not get social security benefits, or we'll get less, or the kids will get less support in school. And these are difficult ethical problems. So I'm happy to see that people did not fall asleep and even got excited, and some want to yell at me back, so please do.
We don't have time for yelling.
So come to me.